I think the first thing that I need to say is that COVID is not over. People are still catching COVID, some are still being very ill, some ending up with long COVID. Our NHS is still battling with COVID itself and the terrible effect it has had on the whole of the NHS's ability to do its job and catch up with the backlog which COVID produced, on top of the waiting lists which already existed and were growing in 2019 before the pandemic. It affects the workplace, incomes, families, and of course our health, mental health and social care services. It raises questions about defining a disabling condition which will affect treatment, support, insurance, pensions, income support, careers, jobs and reasonable adjustments which need to be made. And of course, how do we support our children who may get long COVID?
The long COVID story has become a parable for how the UK health system fails to protect people's freedom from disease and illness. It fails to properly rehabilitate our sick. And we're paying a horrible economic price as a result. The OBR has recognised that the welfare cost of long COVID, of COVID in the round, is around £2.7 billion on welfare benefits like incapacity and housing. My Lords, that is an absolutely staggering sum. My Lords, my point is that we can't shrug our shoulders about the impact of conditions like long COVID on the economy. We have to take on the challenge of making this country more healthy and make a pivot towards prevention.
I'd like to focus my remarks on the rural dimension of long COVID because it's having an impact on many people in Devon, where I'm privileged to serve. I'm concerned about rural sustainability and the need to ensure that the government's levelling up agenda is not focused exclusively on urban deprivation. Rural poverty may not show up on government statistics because it's dispersed in pockets, but it's just as real. And in terms of long COVID, research suggests that structural inequalities, including poverty, are important in the development and course of COVID-19 and may form an important context for long COVID.
As well as the breathlessness, chest pains and loss of taste or smell which characterises long COVID, those patients also exhibit a cluster of symptoms such as debilitating fatigue, post-exertional malaise, cognitive dysfunction, POTS and sleep disturbances that are also diagnostic of ME and other post-infection syndromes. And so while all the funding for research into long COVID must be welcomed, it's disappointing that some researchers are still either ignoring or are simply not aware of what has already been learnt about what may be causing ME and how this could help us to understand the causes of long COVID.
My Lords, we have heard that some 2.1 million people have self-reported as part of the ONS data collection programme symptoms attributable to long COVID. This is some 3.3% of our population. What is striking is that some 500,000 of those individuals report having had COVID some 2 years previously. This represents a substantial ongoing chronic burden of disease and something that we should all be very conscious of in terms of the potential impact in the way that we're able to deliver healthcare through the National Health Service.
The pandemic has tested us all in many ways, as I'm sure the noble Lords will agree. Governments and healthcare systems around the world are all facing the same set of challenges in tackling long COVID. I am under no illusions about how these add to the existing challenges facing the NHS, some of which have been already debated in the Chamber. What we can all say is that we've got much more to learn about long COVID. It's something that we need to continue to be guided by the science, but it's a virus which definitely has not gone away. And unfortunately, as mentioned by many, we're going to have to live with COVID and long COVID for a long time to come. So with that, we need to continue to be proactive, to prevent through our vaccine programmes, to treat through the NHS services, to research, to continually improve our understanding and support people to get back into work.